Tonight, a hero send-off across the border in Wisconsin. The community showing up today for hundreds of employees losing their jobs at Sacred Heart Hospital in Eau Claire and then at St. Joseph's in Chippewa Falls. Both will close tomorrow. The closure is shocking not only the community, but the people who work at those hospitals.
As Jennifer Hoff explains, the move means much longer drive times and has people concerned for patient care.
St. Joseph's Hospital in Chippewa Falls dates back to the 1800s. Its doors opening then started by nuns and rooted in ministry.
I wasn't quite sure what to think. Thank you.
Except instead of serving all people, Hospital Sisters Health System won't serve any starting tomorrow.
These patients who are once local and trying to seek care locally are going to have to go much further for care and treatment. And that frightens me a little bit.
Robin Schultz is the director of emergency services who first learned it would close in January. A month later, the hospital stopped admitting patients. Now, a near shell of a place that was the area's lifeline.
It just keeps escalating and the problem grows bigger as the issue unfolds.
Time, though, isn't just ticking here, but at Sacred Heart Hospital in Eau Claire, nearly 30 minutes away. When it also closes Friday, will more than double drive times and put pressure on the city's other two hospitals already at capacity.
Our biggest impact at this point is going to be our turnaround times.
John Schultz is the city's EMS deputy chief, and despite 30 years on the job, never saw this news coming.
It was a bomb that was dropped,
forcing Schultz to find another hospital to provide his department training, medications, and supplies for 7 ambulances that run on 11,000 calls every year.
Our closest one from here is, we can go to Menominee, we can go to Osseo if we had to, and that's going to add an hour to an hour and a half to our trip.
A persistent problem playing out all across the country.
The community isn't just losing an ER, it won't have local access to labor and delivery, surgery, drug and alcohol treatment, and even chemotherapy.
Upending their lives and the 1,500 people caring for them, all of whom will lose their jobs.
Yeah, it's, sorry.
Including Schultz, whose own husband she'll have to count on to keep leading the ambulances services just a little bit longer.
She had no idea whatsoever.
He was actually going to retire this summer, and I think that will be one of the hardest things, is to walk away from that. But knowing he's still doing what he loves, we'll be fine.
An industry-wide trend, they say, now hitting too close to home.
We'll get by. The hospitals will get by. We don't have any other choice.
Jennifer Hoff, KARE 11 News.
Well, besides the hospitals, the area is also losing several primary care clinics called Prevea Health that are also closing. But the presidents of both systems say their other locations in eastern Wisconsin and Illinois will stay